actual angle of the mandible, and I always draw it out exactly where the bone is. And the reason being to differentiate between when I'm heating jaw and when I'm heating face, because there will be slightly different techniques there. So I'll just draw exactly along the bone.
On the inferior border.
Inferior border of the mandible, right there. And I double check to make sure I'm not, yeah, that's perfect. And the next thing I do, I take a vertical line down from the modiolus, and I create this triangle, and this is my no-go zone. I never heat there. And then I connect a bit low there actually, so just a little bit higher. Perfect.
Who asked Dana to be here?
Dana got work today.
And then I take the modiolus to the pinal junction, just there. And I come over to this side, and I do exactly the same. Perfect, just along the bone. And then vertically down this way, and that's my X, I don't go there. And then I think it's a good idea to connect these two so you know where you are at all times. And then again, just from pinna to the corner of the mouth. Then I find my sternocleidomastoid, and I do two things. The first thing I do is I go along the sternocleido, here and here, and I find where I would imagine my cervical mental angle. And my cervical mental angle is right there. And based on where I want to create that definition of the cervical mental angle, I draw a line like this. Now that I've sort of created my borders of where I'm going to be heating and treating, I need to determine my access points. Personally, I don't perform any heating or liposuction from a central point. I feel that doing that may create more of these ridges. Instead, and for the purposes of dermal contraction as well, I come at it from the side. So I like to choose a point below the mandible, so not on the mandible, below the mandible, that would allow me access to both the central mound, the lateral mound, and into the face. And usually it's very close to this lateral aspect of the triangle, so that's probably a good access point. This point is actually called Rovati's point. He described it. Because from this point...
Who is this person?
Rovati is one of the pioneers of this technique. Did it for years and years and years in Italy. You visited him, right?
Yeah.
So you can actually, from this axis point, you can heat this way, and this way. And you can heat all of this central mound. You can heat also laterally. And then you can do a very nice technique called Rovati's internal rotation. And what you do is you rotate the internal probe, and you see this soft tissue here, you really, really stamp it down to give that nice jawline definition. She already has a nice jawline. This is just sharpening it up a bit. All from this one axis point. Another thing you can do is you get the patient to clench her teeth in the back. Again. May I show you? Give me your hand. I want you to do this. Look.
Okay. No.
Okay? So relax. Go. There's your mesenteric tuberosity. That's usually where the artery, vein, and nerve cross. So right at the mesenteric tuberosity. Go again, please. Again. So she needs to clench and relax. Clench and relax. Again. Again. Yeah, there it is. It's right there. So what I do is just from below the zygoma all the way to this point, I can heat all of this. And the way I do it is I make a small access point just there. That's Hamadani 2. And from this access point, I can heat all of this very safely. And from Ravati's point here, I can actually heat this a little bit to try to reduce some of this jowling, contract it up. So you can do just a bit from here. You have to be very careful, of course, because of the nerve. But then the rest from there, you're quite safe. And then this is Hamadani's point. And from here, what you're going to do is you can actually cross hatch. Everything you heated from this point, you can cross hatch. And now what you have is these intersecting lines of FSM contraction, gives you a very nice definition. Turn this way. We're going to find this one. We could actually even go a little bit more here. So we'll put a circle on it. And again, you'll get a feel for this as you do it. Put a big X there. And I'll probably end up doing another one there, big X. Can you clinch again?
Yeah, stretching.
Again. Yeah, there's her. Again. Yeah, that's masseteric tuberosity. There's the zygoma. So we're going to just go like that. Make an access point there. And then from here, we can heat a little bit there. You can heat that way. You can heat that way. And you can heat centrally.
Good question.
You should get a nice lift. Now, just one last thing, and then absolutely, I'm all ears. I always, before putting the tumescent in, I like to do pinching to determine how much fat I expect to remove. To be honest, she needs to understand, if I remove a lot of fat here, I may expose her bands, but I'll actually come in from here and heat under the muscle a little bit to try to contract that. So she'll get a nice result no matter what. But just based on my feel, my pinch of the tissue, I don't expect to remove more than 4 mils in that sort of cervical mental space.
But do you really need to remove if you're going to?
We don't have to.
Yeah.
I would remove just a little bit because I want to ensure that she really gets the definition and to get some of the
I told
oil.
you my concern. My concern is you're right. My concern is we're going to expose her band.
Absolutely. So if you want to do it without,
Because
you
I
can.
can't just
They're already
without
there.
it.
We don't have to do it, but even when you do want to remove just a little bit, 1 or 2 mils, I'm going to show you a way where you can actually go under the band and heat it. And the bands may become exposed, but there's ways to deal with it, like band cutting or toxin. We can talk about that. But I would remove, at least from the neck, just 1 to 2 to give space for the fibroseptal network to remodel. I wouldn't take more than that out, but if you want to do it without, we'll do it without. I wouldn't remove anything from here, and I don't remove anything from the face. It's just heating. So if you're concerned about the bands, no problem, but there is a little bit of fat here, for sure, that could have been removed, 1 or 2, but we can do it without just for us to see how it's...
Because we did discuss about some of the visibility of the band that bothers her.
Then we won't do that. We'll just allow the fat. Sometimes though, unfortunately, even when you heat just with face set and you remove absolutely no fat, you may also get a little bit of exposure of the band. She has to be ready for that. If she does have some band exposure, then feel free at some point to deploy my Elevate, or I'll show you a very nice technique using a no-core needle, where what you do is you just grab the band. You obviously anesthetize. It's a 5-minute procedure under local. You come in with the no-core and you just cut it in multiple spots, and then you scrape it off the dermis. But today what I'm going to do for you is I'm going to go subplatismal. It's an advanced technique, but I'm happy to show it for plastic surgeons.
So around here, I mean, that I fully understand.
Yeah.
Okay, well, that's pretty good.
Yeah,
I wonder
and
whether
then-
you go because that's a message, but
Yeah,
that's
it's right there.
cutaneous ligament. Would you consider coming up just?
You're right, actually, it was just based on how I felt it. I would actually do it like this. There you go.
Yeah, because the other side's perfect.
Well, it had to do with her clinching and me not being able to feel it. The clinch again. Yeah, you're right. It was more there. So perfect. That's it. You just heat that zone, and she'll get a nice contraction.
Okay.
And if that's the case, we don't even need the cannula, the blue one. We just need the.
So essentially, you're hitting this, you're hitting this
Correct.
part for here.
Correct.
And I love this.
The cross hatch shape, that Ravati. You don't love Hamadani's point? I actually think Hamadani's point is better than Hamadani too. You'll just see. Okay, give me a minute. You'll see how great it is. Ravati in all his glory.
Excellent.
All right.
Well, you're our guest because we can't actually give you
Full credit.
until.
Use the same axis point, but start to go lateral.
And then I still need to insert that part.
We'll do it in the end. No worries. Just for pain purposes, nothing more. Yeah. And you can do it with 20, you can do all of that lateral zone. Just sort of slowly go back, retrograde. Yeah, that's more than enough there. You don't need much. Just enough to wet the tissue and kind of create a little bit of separation. Perfect. Nice. And then, yeah. Perfect. Now I would do the other side the same way. And then from my point, you can go lower down.
Okay.
And then from Ravati's point, the same point, you have to go into the face a little bit. And then from the upper point, the parotid mesenteric. You have to anesthetize as well.
手法特别好。
But already it's starting to percolate, you can see it spreading. And I usually wait 10-15 minutes after, and I come back and everything is nice and firm. And but you know what, Stephen? Just before you do that, you want to do this side. From that axis.
I was just trying to give you your point.
Stephen, do you have your point?
Huh?
Do you have
We're
your
going to call
point?
it Hamadani,
Yeah.
okay? Just for the publication. The paper.
Is this the book that you might have spoke?
Not the Mertz book, no. So this is Ravati. I wrote a face tight chapter on my technique with Spiro, and I wrote a Morpheus chapter.
Yeah, great.
And now there's another book by Diane Duncan and Dunk Tiriaki. These guys are well known. They just asked me to write a chapter on my specific technique of combination of EBDs and threads. So I wrote one.
Is Steve Mulholland still involved?
Steve is a very, very rich man,
I know.
and doesn't need to be as known. But he can't calm down, Steve. He's just constantly coming up with new ideas, new books. He has an online academy now for how to, become a rich businessman.
I know.
He lives in a castle in England somewhere. Has these masquerade balls with his wife. Yeah, he is.
Still the same wife?
Yeah. Still the same wife. You met them, huh? Yeah.
I know them quite well.
I'm seeing him at Inmode Academy. Every time he sees me, hello, young man. And that's how
He hasn't aged well though.
No, Steve.
Must be.
Well, look, he's fit.
Yeah.
He hasn't gained weight. He's close to 70, Steve.
Oh,
Yeah, he's close to 70. He's not a young pup.
no wonder he call you young man.
Yeah, he calls me young man.
Is he still smoking cigars?
Yeah, of course.
Go to your point now or not?
No point. No.
No,
No,
you,
I only
you
go
need
for
to
the
do
top.
there.
Yeah.
Yeah. So one thing, I'm going to show you a technique called internal rotation, where you're going to really define the jawline. You want to make sure that area is really anesthetized. Just just for my understanding, in Australia, I can only coach him by talking, right? Am I allowed, if you're here, to actually show you stuff?
Well, in the small, safe environment.
Like this, it's fine, right?
Yes.
Because it's your... Okay, so I will be showing you just a few maneuvers. It's easier than talking. In Canada, in the US, in many countries, even in Israel, as long as you're with a licensed physician in a small and safe environment, and he's licensed, you can, as long as he's with you, you can touch.
Don't
the
worry,
patient.
anything Scott can cover you.
Yeah. So you just you be Australian Fadi.
In Australia, if it's an energy-based device, it can be delegated,
It can.
and so you don't have to be a
Ah,
doctor to handle it. And
nice.
so we could be here, I could be delegating.
I
to
see.
you,
Perfect.
or to-
That makes great sense. Okay,
That's
that's
no
good.
problem.
In Jordan and in Palestine, it's not allowed. When doctors come to do training with me and I want to give them hands-on, I actually have to submit their credentials to the Ministry of Health, and they have to give them a temporary license for the duration of their visit. So it's different policies in different places.
It is.
Yeah.
And
But because it's an EBD,
that's
you're
right.
free, you can delegate it.
In fact, there's no regulations around who can use.
So Scott, let me just move to Australia and I'll work full time with you. Just keep delegating.
Yeah,
things
go
to
and
me,
stay with your
please.
uncle
Yeah,
Campbelltown.
that's
right?
all I'll do. You know? No, I don't want Campbelltown. I want to live in Sydney or Melbourne, where the coffee's good. I love what you're doing there.
Yeah, he
Yeah, I
is.
was
He's
there for a
using it.
month years ago. I love what you're doing there. You're actually getting a lot of the zone from this access point. So that's really good. And the only comment I'll have is try to be even a bit more superficial.
Okay.
And immediately subdermal, almost like you're injecting a soft, there you go. That's the plane that you're going to be heating. You okay? Are you okay?
It's okay.
Ni hao.
Ni
How are you?
hao.
Right? Ni hao. Yeah, good.
你好吗？
Ni hao ma?
嗯
Okay.
，Are you
我好
okay？
，Are
Yeah.
you？
Ni hao ma.
我嘴已经木了，发音发不出来。
All right. Which other point?
So what I would do now is I would open up here and just get a little bit of that lower, and then at some point you're going to have to open up here and do the rest of the parietal mesenteric, and then we can actually start because it's been a few minutes. So since you can delegate to me, I'd like to start by showing you a few things.
Sure.
All right. The key, Steve, for me, it's not amount of energy. You can put 20 kilojoules in the neck. Obviously, you can do that. The limit is 12, but 12 to 14. But you can go as high up as 20 and get zero results because you haven't reached the temperatures. So the key for me is efficient elevation of the temperature, and I don't even look at energy except to symmetrize. So I'll show you now. So do you like my point, honestly?
No, I like your point. I mean, it's nice excess. It's nice overlapping excess.
See?
What's the natural question that comes next?
For my point?
Yeah. Who's got more points?
Okay. Good one.
We'll tell everybody you said that when he comes down.
You know, I absolutely love him. I learned so much
Rovati is
from
coming
him.
in October.
He's coming planes we're going to heat, right? So this is subdermal.
Here.
Okay, you feel that?
Just a right. Yeah.
Yeah, that's subdermal. Now, when you heat, you want to
I got a
cantilever.
feeling she had a liposuction before. See this guy?
Yeah, I think she has. It's okay though. This is very safe for post liposuction. Even post, I do a lot of post laser corrections, post vaser corrections as well. You don't want to heat like this. You want to cantilever down and heat like that. Okay.
Why?
That's for this because if you go like that, the heat might actually end up creating a thermal nodule.
Okay.
But cantilevering down keeps you. Look at my hand. Cantilever down.
Mm-hmm.
But this is superficial. I usually do this at the end. When I want to heat, I actually heat deeper.
Mm-hmm.
Okay, just a little bit more tissue there. And that's really the plane you want to do your main heating in. So I just want to do a release. And in fact, I don't know if she's had an aggressive lipo because there's not a lot of fibrosis. It's actually really, really easy to undermine. and I always undermine. You have to undermine. Now, let's say we were removing fat in this case, or oil. I would finish heating one zone, and I would immediately go in and remove the oil. Because if you wait until you heat the other sections, the oil will emulsify and actually make it harder for you to extract. So you want to get it,
one section suck.
and then go to the next section.
Okay.
But I don't know what she's had in terms of lipo,
Probably
because
not.
it doesn't feel fibrotic at all. Maybe she's had something else. I don't know.
There's a scar there, huh?
Yeah, there is definitely a scar there. I don't know. Maybe it was years ago. Maybe it was done very gently.
It's done perfectly for some Chinese surgeon. No scar.
I agree.
No
So look, don't heat just at the midline. You can heat the whole central zone, and just kind of make sure all of that's released. She's not having any pain. That's great. And you just you can go all the way down and heat even all the way to here very effectively. So that's how I do it. Can I have some gel?
It's all there.
This is really the key to the technique I'm going to show you. Now, in her case, she doesn't have a lot of bad skin. So I like to achieve external temperature, and I know when I've reached external temperature that I have the whole flap is heated. But you have to do some maneuvers to get to the external temperature sometimes that are a little bit riskier. You have to be a bit more experienced to do it. So until you get to the point where you feel comfortable doing what I'm going to show you, don't worry about it. Just keep going retrograde. But the key is temperature for me. So look, I'm going to start and be very
the key is
systematic.
reaching the
internal.
as well as
The only reason it's important to reach the external is because that way I've guaranteed that the flap has been heated uniformly.
Okay.
But if you aren't able to achieve external, don't worry about it. Just focus on the internal and try to do internal for about 45 seconds.
That's what happened with that alopecia.
But I think you were superficial there.
Probably.
Okay, here, look. Working hand, thinking hand. I'm in the right depth. If you feel I've got some soft tissue above it, it's not subdermal.
Yeah.
I cantilever down, and the first trick is I'm going to go back slowly, take my foot off, reposition, and come back again, and I'm only ever heating 2 lines in tandem. I don't go, I want to get that zone to contract, so I need the temperature. And I'll watch and listen. I'm going to do a couple of lines and show you. Slow, slow retrograde. That's internal immediately. See? I'm only needing retrograde. That's internal. You hear the contraction of the fibroseptal network. It's like a Rice Krispie.
Sounds like the popcorn.
No, you're making me hungry. See, it takes a while to get to external initially, but that's okay.
But the double, that's
I'm
the
almost
internal.
there. No, I'm almost at external.
How do you know you reach the external?
Because of the sound, it'll change. Just watch. There.
The ding, 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 ding.
Done.
Okay. So you reach the internal as well as the external.
Correct.
Okay.
And I have to see visually contraction. And just from experience, I can tell that I can do a bit more. But I'm not going to go over the same area again. It's quite hot. So I'm going to move. I've just heated here and here, right? Now, always working hand is helping. Thinking hand is helping the working hand. I'm going to go a bit lower. Slow. See, slow to get that internal. It's very fast. It's not like monopolar, it's bipolar. It's extremely fast. And to keep you super safe, never have a problem, take your foot off, reposition, and come back. Okay? Now, with experience, you'll actually be able to go back and forth the way I'm doing now. Look, my foot's on the pedal. It's not moving. And I'm going to get to external very quickly. You see that? But take your foot off and come back. Do it only retrograde. You're not going to get any thermal modules. See, I'm at external now, so the machine is cutting off.
Just remind me of the audio again.
Okay,
So,
I'm going to show you. Listen carefully. This, I'm going to go back to the original area that we treated, and I always give some time for the tissue to cool down. It's that cycle of heating, cooling that's going to give you the contraction, okay? So I'm going to come back and treat that original zone. Look, cantilever down, look at my hand. I'm not like this, okay? It's all about the angle. I'm cantilevering down, and look how slow I move. This first sound you're going to hear is the internal temperature. It's very fast.
that's internal.
That's internal. Very fast. And now I can start going a little bit faster, and I'll reach external very quickly. Still internal. Still internal. Now it's turning. That's external. That's external.
At the same time, you look at the screen. Steven, you look at the screen.
I never look at the screen
Yeah.
anymore, but if you do, it's at
Yeah,
39.
so you know it's external.
Okay.
Yeah, the internal will decrease. Yeah.
So
I'm gonna go to the next line. Yeah, go ahead, Scott.
I was just going to say, so the way that I describe it is the internal is about trains of pulses.
There it is. That's internal. It's fast.
The more beeps you
That's
get,
external.
the more beeps you get in the train, the closer you are to your internal. The difference with the external
external.
is it's a constant pulse rather than being shorter trains.
Listen to the internal.
That's internal.
Yeah. It's very fast. The faster is internal. That's internal. That's external. See? External is a little bit
External
slower.
is more of a single.
That's external. Exactly.
So it's consistent, whereas with the internal, the more pulses per train, the closer the, yeah.
Keep healing. You need to see the contraction.
Do you ever use superficial cooling, like the Hardy does?
No,
No?
I'd rather wait. Are you having some pain
痛吗？
or
有
heat?
点那个喉咙那里边有点不适。
She's feeling what?
She's feeling some pushing around the
Ah,
throat.
that's my mistake.
Yeah.
Sorry. Okay. Is that better?
有点喉咙有
She's
点
still
恶心
feeling?
Still a little bit.
Yeah, let me put a little bit more anesthesia.
来帮你多加点麻药哈。
不是痛是恶
It's
心。
okay. We just have to
Just the
target.
pressure, not pain.
Let's just add a little bit. Pressure is normal. You're always going to feel pressure, but I'd rather just add a little bit and
She said it feels kind of like a pressure and a little bit nauseous. Yeah.
nauseous.
Yeah.
喉咙有一点感觉吞咽难受。
Nauseous is not good.
She said that the swallowing is not that good at the moment.
Yeah, that's normal.
That's probably the anesthetic.
Just the
因为是
anesthesia.
那个麻药，对。
好，
Don't be scared. It's just the
没事没事
anesthesia.
感觉好像喉
Oh, yeah,
咙
we'll just
被
do a
堵
bit
住
more
了一样
down。there.
会的，因为那边封了很多的排风洞。
And like this, and then so we've already heated here and here. Now I'm going to start doing a little bit there. Yeah, I have to be in the right plane. That's internal. That's external.
When you go dun, 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 dun,
Yeah.
dun, dun, dun,
Keep
dun.
your neck back as much as you can.
I know.
Perfect. Sorry. It makes it better for you. You hear the That's external. And then okay. I'm gonna do another round. I still don't see the contraction that I need to
When
see.
you say you're looking for the superficial contraction.
You'll see it.
Okay.
At some point when we're done, you're gonna look, this side is gonna be down, that side is gonna be up. So you can also just relax, just to remove, that's oil. You see the oil? Okay, that's the oil coming out. And I'm not removing any fat. And already, actually, now that I've removed the oil,
Like contract.
you can actually see
Oh,
the
wow.
contraction.
Oh,
Okay.
yeah.
So I'm gonna do one more to give her the best contraction possible. You hear that? You really want to get that FSM. That's internal. Now, with time, you can actually start going back and forth, but I don't want you to do that yet. With time, you can do that. That's external, I'm done. Now I'm gonna go here. See, that protected me. Temperature surge. What happened there is probably nothing would have happened because I moved the probe immediately. But the machine sensed that there wasn't enough tissue between the two, and it was worried about a burn, so it gave me a temperature surge. I get them a lot. So I reposition, cantilever down, and start again. Okay, so it's very protective. So that's internal. You hear the crack? See, there's still some FSM to capture there.
So how does one know the end point? Because for you, clearly.
For me, it's visual contraction.
Okay, but we have done this. We have done all these lines, and we have reached the internal and external.
Correct.
You have some visual
That didn't
Correct.
contraction, but how do you? Why do you
Either,
know that?
as long as you are, here's the way it works. As long as you are really on the internal temp, getting, like, as you're moving, the internal temperature, you either reach that visual contraction, which I see, and that just comes with time, or keep doing it until you get to about 2 to 2.5 kilojoules. But you have to be at the internal temperature. Okay? Agreed? So now we're around 2. I'll probably be, I don't like doing it that way, but when you're starting out, it's okay to do that. And then eventually you'll just get you'll get a sense of the contraction. So you have to get that internal and external done. I'm actually quite comfortable with this now. Gentle. She's very sensitive there, but I have to remove that oil. And once I get that oil out, you'll be able to see that if you look at it from different angles, Steve, you'll see that that zone, which I just heated, is actually different in curvature.
I can see it.
That's
I
it.
can even see it.
Perfect. So now I should move to the lab. I'm going to finish this side and then allow you to do the same thing on your side. So I'm going to have some gel there. So what you're going to do is you're going to come in and kind of reheat some of that all the way like this to get that same curvature, and then move to the other side. And wow, 2.1. This is what I expected. I expect this zone to have 1, 1.5. So generally central zone 2 to 2.5, 1 to 1.5, 1 to 1.5. So that's around.
So that complete your central zone. What you have done just then?
I just completed my side of the central zone, right? Because I did, remember, I heated a little bit here, but it was mostly focused on this. So you're gonna have to heat again. I didn't heat the second and third time here as I did here. I left it for you.
Okay.
If I was doing the case myself, I would have come in and done this more.
So,
But I only did
yeah, I just want to, you have done this, you
just
have done
once.
this.
So you need, I did this 2 or 3 times, but I haven't done that 2 or 3 times. So you need to come back from this point and do it.
So that's my question to you, right? So
You can do it from-
You have reached your 2 kilojoule.
For what? For my half. it's actually for the whole central zone, it's usually 4 to 5. Okay, and laterally you'll do less. You have technically up to 12 in some of the really bad necks, but my average is 4 centrally, 2 laterally.
4
which is
passes.
No, sometimes from 1 pass I see the contraction.
So when you see that, that's the end point.
I'm done. I don't need to provide more heat. And usually that's the case in younger patients with a lot of fat.
Okay. Now I'm seeing the contraction here,
Yes.
but that's the question, right? You want me to go back to that?
No, I don't. This is done. This is done.
Okay.
I didn't do, in my clinic, to save time, I would have done all of it multiple times.
Okay.
But to save it for you,
Okay,
I
I
just did
understand.
this zone.
Okay.
You have to go back from this point and do all of this again
Okay.
to get the contraction here the same as here.
Okay.
But not yet, because I still have to do
Sure.
the rest of my side.
Okay.
So you put some gel for me, Scott, right? Okay, so from here I treated, from this, I treated this way, all the way down. Now I'm gonna start heating all of that this way.
Okay.
So I'm gonna come in, and usually I come in this way.
Yeah, go.
Is it possible to lower the bed a little bit?
Yeah, yeah.
Awesome. I actually like to be sort of more relaxed. Perfect. Bring your neck back, sweetheart. Perfect. And can I have some more gel here? That's it. That's perfect, actually. Yeah. Just there. So now, Steve, look, I did the central. Now I'm actually coming back in, and I'm going to heat here. This.
Yeah.
All the way to the, and I'm going to show you Ravati's internal rotation. You can hold it like this if you want. I prefer to hold it like this myself. And I always use my other hand to give me the counter traction. So slow. That's internal. And you hear the cracks. You hear it?
Yeah. So what is that crack?
That's the fibroseptal network contracting, coagulating, like a fried protein or frying an egg, really, yeah. It's introducing fibrosis, but a controlled fibrosis. See, I'm there. Usually in the lateral, you don't need to do it more than once. Sometimes you have to do it twice, but that's it. I'm cognizant of the fact that I have vasculature there, jugular system, but I'm in a different plane. See, I'm getting to external quite fast, so I probably will reheat that area. Give it a few seconds, and I can move further away to kind of start heating along the mandible. Again, this is immediately subdermal. I want to go a bit deeper under the mandible, and I want to rotate my probe. That's internal rotation. And here, I'll actually perform a procedure called stamping. So watch, I press and I stay in position. Really contract that FSN, and I'm pushing against the bone, contracting that FSN, molding it along the bone. It's almost like sculpting. You heat the material to a certain temperature, you can actually shape it. That's exactly what's happening here. Again. You hear it?
Yeah.
Now I start to move back slowly. Another way you know that you're done, if you don't want to look for the visual contraction, you lose the internal resistance. When you lose that going through, once you lose that, you're done. That's another way to know, okay? That's another endpoint. And then I come back here to redo this part because it went to external really quickly. I wasn't able to get to internal, so I'll redo it. So I'm done. Now I'm gonna come in and I'm gonna grab the needle again.
You've got the needle right there.
So let's release some of the oil. She doesn't like this part, I know, but I like to get the oil out because I'm not gonna do any sucking. Although I would have liked to do just a little bit, just a mill, but it's okay. We're gonna do it completely without, just to show you how powerful the contraction is. Done. And then the needle, please. Merci beaucoup, monsieur. And now Hamadani's point. The exact same thing I did here to define that jawline, I'm going to do to define that cervical mental angle. But I'm also going to cross hatch and treat this zone in this direction to create more collagen contraction in that zone. So very, very gentle. Okay. Bring your neck back, dear, a little bit. Perfect. And now, even more, I'm in, okay, and I'm gonna start by doing a little release from this direction, and I have more resistance because now I'm targeting the horizontal fibroseptal network, and I'm gonna come in exactly where I wanna be right there, just make sure that I'm in the right position. I'm not gonna cross your midline, and I'm gonna begin by stamping. Scott, could you put some more gel?
Absolutely.
Thanks, buddy. Yeah, foot pedal, thank you. I usually, in my clinic, I'm used to doing it sitting, so. But that's it, we're done. Now look. And I always stop about half a centimeter from the opening. Again, the second time. And then just like
External temperature.
that's internal.
No, oh yeah.
Yeah, now I start moving slowly to really contract it further and mold that skin by reaching that external. And it's going to happen very fast. That's external. And even here, from my point, I can cross hatch. And I use my finger sometimes to guide the tissue. See this part? I use it to guide. And look, I'm cantilevering down. Perfect. Then I'm going to come here and cross hatch that. Keep your neck back, sweetheart, just a little bit. We're almost done. Done. If you come stand where I am, get that oil out. Sorry. I know you don't like this part. Okay, we're done. That's all. I'm not going to heat her anymore today. But literally, come look.
Steph,
From-
why is she complaining? That part.
She's complaining when I go like this.
Yeah.
For the sensation of the muscle. Some people just have a big muscle, big thyroid. And she doesn't like pressure. She's a pressureful. But please come look at it from here and look at the difference.
Yeah, I can. This is
Can you appreciate
yeah,
it?
yeah.
Okay.
I mean, I appreciate more on that jawline.
Yeah, it's really nice.
沙拉先出来了，
Without any fat removal. And this will get even better over the next.
脂肪也溶掉挤出来了。
Now, you can do more. Can you bring your neck back? You can actually, if you like, even heat here. Look, you can actually heat here as well. The lateral neck, it gives a nice contraction and a nice redraping.
So we know that heat works so much better in the Asian population. Any radio frequency.
You know why? Because the skin is thick and there's a lot of collagen. But I've used it in Europeans, thin European women, it works.
Yeah.
Not as well.
I'm just saying,
Yeah,
well, I mean, I just pointed to the fact that each time we operate them, the scar tend to last longer, because become hypertrophic a little bit longer.
You're right, yeah.
And that's why any form of heat or any form of injury.
Now, one little thing I like to do is I actually like to get this zone again. I come at it from here. I kind of stopped here, gives a nice definition at the end.
And you don't have any sensory.
No, I've had sensory when I've been deeper and I've hit the greater occipital and it sucks, but not here. You're fine as long as you're superficial. Greater occipital's there more, but stay in the right plane and you won't have any issues.
Perfect time for me is that lateral, or the medial border of the sternocleidomastoid as an entry point.
Yeah, you're fine. You can use it. What you've done there is you've just taken Hamadani's point and tried to make it your own. So you need to stop, Scott. I have words.
Look, absolutely. Have you met me? My name is not Scott. My name is Scott.
Done. Okay, I'm happy with this. Now, the next phase would be I would get her to really extend the neck up, and I would come in. Look how superficial I am here. Almost like I'm doing a subcision. See? I don't go deeper. Just kind of release as much as I can and provide just a few passes. So I'm going to do that now. So just kind of start. Yeah, I think she has had some stuff here. Here she's quite fibrotic. Maybe Sculptra or Radius or filler or something. But look how superficial I am. Okay, I want you to get a sense of that. Immediately subdermal. And make sure it's coming back and forth. That means I'm in the subdermal plane. And you have to cantilever down. I'm just heating the superficial fascia. I have no intention of heating fat. So then again. See, I've lost that resistance. I'm almost done. That was a bad coupling. See, I'm going to get to external very quick here. You don't have to be religious about it. It's really just getting that zone heated enough to contract. The contraction will come over time. So just a couple of passes there. It's tricky. You got to get it right in the right plane without any dermal attachment. You hear it? I basically got to external. So I'm done in this zone. Let me get some of that oil out. You can feel the fat kind of get a little bit harder. That's the contraction that you got. We're done. And then I would come here and heat this zone. So may I have the access point? In my clinic, I also do this part. I'll do this part. I like doing this part. This part's important. So this part here, the lateral neck along the sternum. Can I have some more gel? I really want this to contract a little bit more. You can see it's a bit loose, so just... And I still have some resistance, but I'm losing it. Good. Now, have the needle. This is Lu point 2, right under the zygoma. Just enter here. Good. And then,
So it's interesting, in the face, you really want to go almost up there.
yeah, absolutely.
Whereas in the neck,
Look
you
where I
just
am.
want to be
A little bit hotter,
Mm.
but no thermal nodules. Good plane. You can also actually go back, and I'll show you a trick at the end to get even more contraction. if you want to be, complete in your work. So just a few releases. Fascia of Lorraine, platysma auricular fascia, really important to heat that. You get a very nice lift there. It's quite fibrotic. She's had some stuff here before. Sorry. Done. Done. But it's important to release all this. Has she had? Can you ask her? Has she had threads or Sculptra or radius?
She had some sort of a
我之前
temporal
买过
lift.
线，
A what?
She had threads before. She also
Ah.
had some sort of surgery. You can see an incision in the temple.
Ah, okay.
I just couldn't work out what they're doing.
Was it in Turkey?
No, it's in China.
I think they were maybe endoscopic. These endoscopic
Okay.
mid-face lifts like Ramirez or the pay lift and all that. Anyway, gel please. Okay. If she has pain, we'll have to add some more anesthesia. I think she'll be okay. See, that's again my mistake.
What happened there is
Again, temperature surge. No, they were touching. I just don't think I had the right angle. So now it'll be okay. Good. See, my other hand is.
That was the surge as well, right?
No.
When that happened, what?
No, that was bad coupling because I took off. What I did is I took my hand off while kept my foot on. So not a surge, no. Now, one thing I also do
Is she feeling okay? Is she feeling heat or pain?
immediately after the treatment, I usually inject PRF,
嗯，
What's PRF?
听
platelet-rich fibrin.
Okay.
I also have carboxytherapy in my clinic, and I actually deliver carboxytherapy to try to control the fibrosis over time.
我都
It actually
OK，
really helps.
没有问题。
And also, if you have external ultrasound, on this machine, can Dr. Liu have Forma? Forma can help.
She
a lot.
has.
Yeah,
He has. He
He
has.
has. Okay, good.
Yeah.
How does Forma helps with the?
RF tends to create, because of the heat, this vasodilation, which allows the lymphatics to work better. So I always offer them after every face tide. I get them in 3 times over the next month or so, and I do some PRF, carboxytherapy, and external ultrasound. If you don't have external ultrasound, then you have to use the Forma. It's quite a few FSMs. So when you have taking so long to get to external, it means there's really quite a bit of the FSM. See, I couldn't get to the external, so I don't force it. The key there is that I got to the internal. And I'm just going to heat a couple of times here for completeness sake. But I don't want to be too close to the tuberosity, so I'm actually done.
So the fact that you're running over the head follicle
Done.
doesn't really
No.
concern you.
It doesn't concern me at all because I'm not stamping and I'm deep. Okay? And then I release all the oil. There's quite a bit of oil coming out. This is oil, you can see it. It's not normal to mess up, it's bubbly. Okay? And that's it, I'm done. Now,
Would you ever go and wash it out?
yeah, some people do that. What's his name? forgot his name. He puts a bunch of tumescent in
Yeah.
and then starts to
Mix it up.
squeeze it out. I don't think there's a need as long as you get all of it out. It's fine. I worry about spreading it into other areas this way and potentially. But yeah, that's a great idea. Berman does that. That's his name, Ethan Berman. So that's it. I'm done. Now, one other thing I want to show you. It's not very necessary in her case, but just for you to get an idea. And what's the total with phase 5.1? That's very conservative settings because some people will do 6, 3, which is 9. So I don't go by energy. I go by temperature. You can also do, if you notice.